Hello, today we're going to be talking about cardiology part 2. So we're going to finish up some of the first drugs that we learned that are solely acting on the heart, and then we're going to move into our drugs for hyperlipidemia and get started on the first ones that we learned for that. And just a heads up, this is the first time that I've gone through these since I've drawn them, so it might be a little bit rough than previously. So we'll start with our HCN blocker. So the drug in this category is ivabradine. So this is Brad, and he's riding in a polar region, and there's some IV coming up and grabbing his bike. And so the mechanism of action is that this blocks hyperpolarization. So hyperpolarization, that's why he's in the North Pole, the polar region. So blocks the hyperpolarization activated cyclic nucleotide gated channel, HCN, which is responsible for the cardiac pacemaker. So the result is a controlled heart rate. And again, so hyperpolarization, he's in the polar, and then cyclic nucleotide, he's cycling. So Brad is cycling, so ivabradine, hyperpolarization, you get it. Adverse effects, so we have bradycardia. Think about how when it's cold, your heart rate drops to, think of like a bit like someone who's hibernating. Like bears that hibernate, their heart rate gets lower while they're hibernating. Hypertension, this little piece of IV is kind of adding a little bit of excess tension to his bicycle. And then this one's my favorite, so AFib. So Brad here, he told a fib, a lie. So liar, liar, pants on fire. Boom, AFib. Vision changes. You can't tell because this is a blurry picture, but he's wearing glasses for vision changes. But you can see that angioedema. Oof, look at those swollen lips there. And then ventricular dysrhythmia. So ventricular. So this igloo has a vent, a chimney. Ventricular dysrhythmia. So that's your HCN blocker. So now we'll move into our inotropes, which is this whole picture here. It's really just a lot of pictures that are all kind of put together, but they're all inotropes. So as a reminder, a inotrope is anything that increases the heart contractility. And so these are used mainly for heart failure. So we'll start over here with norepinephrine. Or as I've shown it in this picture, this is a pine tree with our no symbol on it. So no pine rephrine, no epinephrine, or no pine. And well, I'll just kind of cover these all. We also have dopamine, so dope, and again, there's a little mean face in there. He's a mean piece of dope, dopamine. And then we have this but for dobutamine or dobutamine, but but is funner to say. And so going back to the mechanism of action, well, we have this little stream running through here. We have an alpha, which the alpha symbol kind of looks like a fish. And then we have a beta fish. So norepinephrine and dopamine are beta 1 and alpha 1 agonists. Ignore this beta because that beta is just showing you that it's this. But anyway, so a beta 1 and an alpha 1 agonist. Whereas dobutamine is a beta 1 agonist and also a very weak beta 2 and alpha 1 agonist. Now, before we get too far into this, let me just remind you all that beta 1, one heart. So beta 1 is gonna increase your heart rate. And like I said, contractility. Beta 2, you have 2 lungs. Beta 2 receptors are gonna stimulate lung bronchodilation. And then alpha 1 is peripheral vasoconstriction. So keep that in mind whenever you're seeing these betas and alphas. The adverse effects of norepinephrine are extravasation injury, which, to remind you what that is, it's when if you say are administering this through an IV and the IV is not properly in the vein and it's actually in the tissue, it's gonna destroy the tissue and you can get necrosis and then your hand falls off. Yeah, so then that's what that is, extravasation injury. And then we have hypertension. So again, an alpha-1 agonist is going to cause peripheral vasoconstriction, so that's going to cause hypertension. And then dopamine here, in addition to also having the adverse effects of your extravasation injury and your hypertension, dopamine also can cause arrhythmias. And then dobutamine causes adverse effects of tachycardia, which is why this little butt is in the shape of a heart for tachycardia. So as we move down this stream here, we run into this rhino who is charging this water mill for milrinone. So water mill, rhino, milrinone. Mechanism of action is that it is a phosphodiesterase 3 inhibitor, which causes vasodilation. And phosphodiesterase 3 can be abbreviated as PDE3. He has 3 horns. And also to help you remember vasodilation, this river, it starts kind of small, really small up here. And as we go down and get closer right where this mill is, it gets wider, it vasodilates. Adverse effects of this one are ventricular dysrhythmia, so vent, right here, the chimney, ventricular dysrhythmia. And then thrombocytopenia, which was increased platelets, which is why the rhino is standing on a stack of plates. Next, we'll move on to epinephrine. So we have a eastern pine tree, eastern pine branch here for E-pine epinephrine. And there's a squirrel on it. So this is a beta-1, beta-2, and alpha-1 agonist. So not really a good way to remember this, but there are 3 separate little pine groupings here. So beta-1, beta-2, alpha-1. Adverse effects are tachycardia. So we have a heart on the squirrel. Tremor. So think about squirrels when they're climbing trees. They shake the branches, make the branches look like they're tremoring. And then we have blood pressure changes and dysrhythmias. Then we'll move on to our phenylephrine. So we have a fennel plant and it's being eaten by, this is the dog from Up, who was like the alpha dog. And you know how they're all like squirrel. So that's kind of how they're related. Anyways, phenylephrine is a alpha-1 agonist. So he's just the alpha dog, alpha-1. Adverse effects are hypertension. So remember, alpha-1 is a peripheral vasoconstrictor, so that's why it's going to cause hypertension. You could have reflux bradycardia, so that's what's shown here. And then again, that extravasation injury. Then we'll move on to digoxin, or an ox who is dig oxen. And so the mechanism of action is that it inhibits the sodium potassium ATPase, which increases intercardiac calcium. So the more calcium you have in your heart, the more inotropic, the more contractility it will have. And so to represent that, in this hole that the ox is digging, we have salt for sodium. His horn is suddenly turned into a banana for potassium. So he's digging a hole. He's inhibiting the sodium that's knocked over and the potassium. And as he's throwing the dirt over here, the dirt is in the shape of the heart. We have calcium here because it is increasing the intercardiac calcium. Adverse effects are bradycardia, shown here, also heart block. Vision changes, he's wearing glasses. Confusion, because he's like, why is my horn a banana all of a sudden? And then lovely, lovely diarrhea here. Beautiful. All right, so now we're going to change gears and move on to our hyperlipidemia drugs. And we're going to start with our bile sequestrants. So the first drug in this category is cholestyramine or Questran. And so I'm like, who better to represent going on a quest than a Viking, right? And col looks like colon, and also, so that's why he's sitting on a toilet. But also, the mechanism of action is that it binds bile acids in the small bowel and excretes it in the stool. You just poop out cholesterol, basically. There's other drugs in this category called colsevalam and colestipol. So this Viking, he's by a coal fire, and there are 7 pieces of coal right here. So colsevalam, 7. And then it's a terrible drawing, but it's supposed to be one of those fire poles, that firemen come down on for colestipol to put out the coal fire. So that's that. And then adverse effects are GI problems, which shouldn't be hard to remember because he's sitting on a toilet. So then we'll move on to niacin. So Bill Nye, the science guy, niacin. Mechanism of action is this is a cofactor in lipid metabolism. So it inhibits VLDL synthesis and inhibits HDL degradation. So essentially what that means, because the wording always confuses me, it's going to lower your triglycerides and LDL, which are bad, and raise your HDL, which is good. So here, Bill Nye, he is lowering the VLDL and he is raising the HDL. Adverse effects are flushing, which I totally meant to draw his face a little bit red, and I totally forgot. Hepatotoxicity, you can see his liver here. Hyperuricemia, which was common with gout, and gout is like, I don't know, I heard something about having pain is really common in your big toe. So like his big toe is throbbing for uricemia, hyperuricemia. And then hyperglycemia, he has a little lollipop in his pocket. He's eating candy. He's going to get hyperglycemia. So now we have our fibric acid derivatives, which are gemfibrozil and phenylfibrate. So what we got going on here is this rodent, this vermin, this rat vermin is going to represent VLDL, and this cat who's chasing him. And all of this is taking place in a cotton field, which is why we have these little cotton things, because cottons are fiber, fibric acid, phenylfibrate. So help explain this a little bit more. So our mechanism of action is increases VLDL catabolism and elimination of triglyceride rich particles by enhancing synthesis of lipoprotein lipase. So again, essentially that just means we're going to lower VLDL and triglycerides. So to elaborate some more, remember our vermin, our VLDL, he is riding on a tricycle for triglyceride. You ride on a tricycle, triglyceride. This cat, he's like, he looks tasty. And so he's gonna catabolize, he's gonna eat this thing, destroy the rat and his tricycle, which would then lower VLDL and triglycerides. Gemfibrozil, because again, he's holding a gem, and then this rat is trying to fend for himself. So phenylfibrate, in addition to the other fibers that we got going on here. So adverse effects, LFT elevation. So I always think the word LFT looks like lift. And so I usually demonstrate that by someone in the picture lifting something. So the rat is lifting this gem. So LFT elevation. Cholelithiasis, so gallstones. We have these 3 little stones here that are representing that. And then skeletal muscle toxicity. So this cat's, you can kind of see its skeletal muscles a little bit. And then we have our statins. So these are HMG-CoA reductase inhibitors. And so when I was trying to come up with something to draw for this, I'm like, HMG, if you just kind of pronounce it as one word, it's like humming. So we have a hummingbird for humming, HMG. And this hummingbird is bougie. She's got her Prada bag and she's going on a tour, and she's also got big titties, which we'll get to. But so we have simvastatin for, like, this is the Sims. Remember that game, simvastatin? Like I said, she's going on a tour. She's got her camera. She's got her purse for a torvastatin. And she's got her bougie little Prada bag for pravastatin. And so the mechanism of action is that it is going to inhibit the rate limiting step in cholesterol synthesis, which the rate limiting step is this HMG-CoA reductase, blah, blah, blah. But I think rate limiting, think about hummingbirds. They're like super fast. Like they have a really quick rate. And so it's kind of the opposite, because it's gonna inhibit the rate limiting step. But anyways, that just kind of helps me remember that. Adverse effects are LFT elevation. So she is lifting that purse up in the air. Muscle toxicity, not really shown in the picture. Then here we have our gynecomastia. So plot twist, is actually a male hummingbird, and that he's got big titties. Okay. And that's actually legit, because the male hummingbird, the ruby-throated hummingbird, has the red and females don't. Fun fact. Okay, and then we have our azetamibe, so a zebra. And this zebra is standing in the brush while eating Cheerios because he wants to lower his cholesterol. So this is going to inhibit the absorption of cholesterol across the brush border. So again, azetamibe, so zebra, and brush, he's standing in the brush for brush border. He's trying to lower his cholesterol. And LFT elevation is the adverse effect. He is lifting his tail, which is also kind of in the shape of a liver, but not really shown very well. Next, we have our PCSK9 inhibitors. I think that's the category. I didn't write it down. But we have this dog who's a canine, and her name is Allie. And Allie is watching Roku for Allie Rokumab. And then this is Eva from Wally. So Eva, or Evolucumab. And so these are monoclonal antibodies against the PCSK9. So it inhibits the degradation of LDL receptors, allowing them to be recycled. So Eva here likes to recycle. But anyways, that all means that it's just going to lower your LDL. And adverse effects are injection site reaction and flu-like symptoms. So Allie here has to get a flu vaccine, and she's going to get an injection reaction. Then we have another canine one. But this one's different. So it's inclisiran, or incline Cyran. And so anyways, this dog is ran on an incline treadmill for incline Cyran. And so this is an RNA strand that inhibits cellular production of PCSK9. And so here's a single-stranded RNA strand that is holding this dog back. It's inhibiting the canine. Adverse effects are injection site reactions, which I should have drawn this again, but I didn't. So just remember that. And then the last one for today is bempedoic acid. So bemp kind of looks like the word blimp, and it ends in doic, like heroic. So we have this blimp that is being heroically, I don't know, saved, I guess. So that's bempedoic acid is a drug by itself, but you could also combine bempedoic acid with ezetimibe, which is why we have some zebra stripes on here, and that would be called Nexlizet. And so, you know how blimps like advertise things? Well, this one is advertising Netflix for like Nexlizet. Oh, similar. So the mechanism of action for this is that it is a ATP citrate lyase inhibitor, reducing hepatic synthesis of cholesterol. So here we have ATP, a TP for ATP, and it has citrus bombs being dropped on it. So ATP citrate. And then, of course, this blimp looks like a liver. So reducing hepatic synthesis of cholesterol. There's nothing in this picture to demonstrate cholesterol, but hopefully you get it. And then hyperuricemia. So again, Superman's foot here, his big toe hurts. And then elevated LFTs. He's sort of lifting the blimp in the air, I guess. And so that concludes our drugs for this video. Thank you for watching.